This segment of Delmarva Life is brought to you by Community Behavioral Health.
I think you'd probably agree that it's safe to say that recently mental health has really been thrust into the spotlight, a topic that draws lines between sides, particularly when it comes to diagnosis and treatment for mental health.
Yeah, and we're certainly not going to throw ourselves into that debate today, but we are going to discuss what's being done beyond all the talk. And here on Delmarva, mental health services are expanding. Joining us today to tell us more about that is Dr. Suni Jani of Community Behavioral Health. Thank you for being with us.
Thank you for having me.
Okay, before we get into the expansion, let's talk a little bit about the need for mental health services here on Delmarva.
Yeah, so there is a growing need. I wouldn't say just in Delmarva, it's definitely across the United States and worldwide. The statistics are always changing and it's always hard to keep up with it. They usually do it every couple years. The CDC, the World Health Organization, is always trying to find more and more just numbers on what types of mental illnesses are growing, what's causing them. Sometimes it's hard to tell whether it's because more people are coming forward or is it because of more and more environmental stressors causing them. But we can say that the need is growing and we can definitely see it here in the Delmarva community.
So when we say mental health, what all does that encompass?
So there's a very broad definition because, you know, it involves biological factors, psychological factors, and social factors. But I think one of my favorite ways to describe it is the way that any human in any context is able to adapt and cope with the situation that they're in. Because we're all very unique individuals, and I think that's what I like about what make the work I do and what makes us human. And you don't want to kind of put everyone in a context that says this is what it means to be mentally well, that you have to do a certain thing. But whatever situation you're in, your ability to adapt and cope and feel productive and fruitful in your own definition, to have a relationship in a way that's meaningful to you, and to feel functional in a definition that's important to you, right, and is definitely not causing harm to you or others, is something that I would call mental health and mental wellness. And to not have that is where we start moving down the road towards mental illness. And we do have diagnoses, and we have different terms that you may have heard, like depression or bipolar disorder or schizophrenia. But you know, sometimes we have to use diagnostic terms, and sometimes we just use absence of mental health.
Okay.
Yeah.
All right. So let's talk a little bit about treatment. Would you say there's often a stigma attached to mental health treatment?
I think most people would agree there is. I think we see it in many different ways, and I know we've talked about it here before. So definitely you'll see it in the way some people are hesitant to seek treatment, and sometimes you'll see it in the way we talk about people who do seek treatment. So that would be maybe the broad introduction to it.
So do you think we can break the stigma?
I think we are breaking the stigma. I think, you know, today we're in a very different place than we were 10 years ago. And the fact that we're talking about it here today is a big sign that we aren't in the same place we were in terms of stigma. The fact that people voluntarily come and seek treatment at a clinic as opposed to, you know, kind of holding it in. On average, though, you know, I still think that many studies find that it's about 12 years since the onset of symptoms before people seek treatment. But at the same time, the nature of some mental health conditions is that people aren't able to recognize it in themselves. So part of it's stigma, part of it's the way some mental health conditions are.
Okay, so as we mentioned, mental health treatment services are expanding. Tell us about what's happening in Snow Hill.
Yeah, so we had a very unique opportunity. So Snow Hill is this incredible town that I've just come to learn about more recently, and where we've got the Oscar Purnell building. It's this beautiful, massive, early 20th century banker's mansion. That's who Oscar Purnell was. And what we're doing, so this will probably take a good long while, we have to renovate it and try and run our clinic in it for at least 5 years. We definitely want to do it longer because we'd like to be able to have mental health services provided for Worcester County. So we're actually trying to bring community behavioral health services to Worcester County out of Snow Hill. That's essentially what's happening.
So what kind of services would you provide there?
So we do, well, we try to do as much as we can in a clinic basis. So we offer medication for people who need it, and we offer therapy. We offer different types of therapy, so it's not just kind of meeting with someone once a week. Sometimes people have to come every single day, and we call that intensive outpatient. And there's also services for people who have addiction. So, and we, what community behavioral health does in general is try to rise to meet the need of the community it's in. So the more we get to know the community where each of our clinics is located, what we try to do is adapt.
You're very passionate about what you do. It's your whole family does it, for that matter. This has to be exciting for you and your family.
It really is, and we feel extremely privileged to have this opportunity, and we're very grateful to the town of Snow Hill. We're grateful for this opportunity. We know it's going to take a while to renovate the inside of the Oscar Purnell building. That's a little part of the arrangement, so it's hard to kind of give a timeline for this. It sounds like a lot of it's going to be based on what contractors tell us. So while the opportunity is something I can talk about today, when I can give services is going to be a little bit dependent on when they say the building's safe and ready. Yeah.
Are any hopes of when you might be able to?
So right now they're telling us it's between 12 and 18 months. But what I'd like to be able to do is, as soon as there's at least like a floor that's safe for people to go into, we can at least start doing something for people as soon as possible, because as you said, we are very passionate about what we do.
Dr. Sweeney, Johnny, thank you.
Thank you.
Behavioral health, community behavioral health.
Yes.
Thank you so much. All right.